Good afternoon, all of you. Today I am going to show you how to report lab request. Before that, let me introduce you my name. My full name is Abdiaziz. I am from Kenya, especially the Dab, Garissa, and today I am ready to show you how to report lab request. Before we report this lab request, first, what do you need to do? First, you must have gloves, because the rule of the doctor must have everything when he is going to do something. So now, this is the lab request which I am going to report the patient's details. So today, let us see how I am going to report this lab request of the patient's details. So here is the name of the hospital name. Also here is the logo. Also here we have PO Box plus the 8852 Nairobi call. This is the number of this hospital. Also here is the Gmail of the Al-Baghra Pharmacy gmail.com. Here is the lab request form. So we have two different parties that we are going to differentiate. Here is the details of the patient. Also here is the report of the patient's details. So here we have a lot of different words that we are going to write the patient's details. So here is the name of the patient. Also here is the age of the patient. Here is the sex of the patient, whether she or he. Here is the address or block of the patient. Also here is the phone of the patient. After when we finish all these details, then we are going to start the assessment, which is blood, stool, or urine, or swab, throat swab, or vaginal, abnormal vaginal. Anything that you are going to investigate, you have to report here. So here is the date of collected, because when you are going to report the patient's details, also you have to write the patient's the date of the time, the date of the day. Here is the investigation required that you are going to investigate whether it is blood or stool or urine. Here is the report to send. Clinical diagnosis. So here is the doctor's name. Also here is the sign of the doctor. So this part, the person who is in the laboratory must have to write the details of here. So now let us start. First we have to write the patient's name, which are Abdiaziz Osman Noor. Here is the patient's age, 32. Here is the sex, which is male. So address or block E1. Here is the phone of the patient. Here is the specimen that you are going to investigate whether it is blood or stool or urine. Like urine and blood. So here is the date collected, 27/1/2021. Also here is the investigation of the urine or blood. So here we also write BS for MBS. Also we write urine lines. Also we are going to write the pharmacy which is going to report, like So here, when will you write something here? When somebody says to you, I'm suffering from UTI or infection. So when somebody is suffering from infection, so you must consider that the patient is suffering from infection of the bladder or infection of the urethra or infection of the nephritis, which is kidney. So now here, because the patient says to you, I am suffering from infection, and that infection and that infection is from the infection of the bladder or urethra. So here you write UTI, because UTI can cause is the meaning of UTI means urinary tract infection. So UTI. So also here you write the doctor's name. Abdiaziz. The sign. Now we have finished the details of the patient. So now we are going to investigate the patient's disease, which is urine